Section 1. Hidden Threats. Understanding biological hazards at work. Our workplaces can often harbor unseen dangers. Biological hazards or biohazards are one such threat. These are biological agents that pose a risk to human health. They can be found in various sectors and can have serious consequences. Understanding biohazards is crucial for protecting workers. Exposure to these hazards can lead to infections, diseases, and other health problems. It is essential to recognize the potential sources of biohazards and take appropriate precautions. Awareness and proactive measures are key to mitigating risks. Employers and employees must work together to create a safe and healthy work environment. By understanding the nature of biohazards, we can better protect ourselves and those around us. Section 2. From Hospitals to Farms. Unveiling Workplace Biohazards. Biohazards are not limited to one industry. They can be found in various workplaces, each posing unique risks. Hospitals, for instance, deal with infectious agents daily. Healthcare workers are at risk of exposure to bloodborne pathogens. These include viruses like HIV and hepatitis B and C. They can also encounter bacteria resistant to antibiotics, posing serious health threats. But biohazards are not confined to healthcare. Agriculture workers face risks from zoonotic diseases. These are illnesses that can spread from animals to humans. Construction workers might encounter mold or bacteria in building materials. Understanding the specific biohazards of each industry is the first step towards effective risk management. Section 3. Gauging the danger classifying biological risks. To manage biohazards effectively, we need a system to classify them. This helps us understand the level of risk associated with each agent and implement appropriate safety measures. The 4-risk group classification is widely used. Risk Group 1 agents pose a low risk to individuals and the community. They are unlikely to cause disease in healthy individuals. An example is Bacillus subtilis, a bacterium found in soil. Risk Group 2 agents pose a moderate risk to individuals, but a low risk to the community. They can cause disease, but are unlikely to spread to the community. Effective treatments and preventive measures are usually available. An example is Staphylococcus aureus, a bacterium that can cause skin infections. Risk Group 3 agents pose a high risk to individuals and a low risk to the community. They can cause serious illness, but are unlikely to spread easily from person to person. Effective treatments and preventive measures may be available. An example is Mycobacterium tuberculosis, the bacterium that causes tuberculosis. Risk Group 4 agents pose a high risk to individuals and the community. They can cause severe illness and spread easily from person to person. Effective treatments and preventive measures are often not available. An example is the Ebola virus. Section 4. Shielding workers. Effective strategies for biohazard control. Protecting workers from biohazards requires a multi-pronged approach. This includes administrative controls, engineering controls, and personal protective equipment, PPE. Administrative controls focus on policies and procedures to minimize risk. Examples include regular risk assessments, vaccination programs, and training on safe handling of biological materials. Engineering controls aim to isolate or eliminate the hazard at its source. Examples include using biosafety cabinets, sharps containers, and ventilation systems. PPE provides a barrier between the worker and the hazard. This includes gloves, masks, gowns, and respirators. The type of PPE required depends on the specific hazard and the level of risk. Effective biohazard control relies on a combination of these strategies. It is essential to assess the risk, implement appropriate controls, and regularly review and update procedures to ensure worker safety. Section 5. Real-life impact stories of workplace biohazard exposure. The consequences of biohazard exposure can be devastating. Take, for instance, the story of a lab technician who accidentally pricked herself with a needle contaminated with HIV-infected blood. Despite immediate medical attention, she contracted the virus. This tragic incident highlights the importance of proper sharps disposal and adherence to safety protocols. Another case involved a group of healthcare workers who contracted SARS during an outbreak. They had inadequate PPE and training, which led to their exposure. These stories underscore the real-life impact of biohazards and the importance of proactive safety measures. These incidents are not isolated. The World Health Organization estimates that over 2 million people die each year from work-related diseases. Biological hazards contribute significantly to this burden. Therefore, prioritizing workplace safety is not just ethical but also crucial for global health. Section 6. The importance of training equipping workers to face biological risks. Training plays a pivotal role in preventing biohazard exposure. Workers need to be aware of the risks they face and how to protect themselves. Comprehensive training programs should cover various aspects of biohazard safety. This includes identifying potential hazards, understanding routes of exposure, and knowing how to use PPE correctly. Training should also cover emergency procedures, such as what to do in case of a spill or accidental exposure. Regular refresher courses are essential to reinforce safe practices and update workers on new information. Effective training empowers workers to make informed decisions, follow safety protocols diligently, and protect themselves and their colleagues from harm. Section 7. Legal and ethical imperatives. Protecting workers from biohazards. Protecting workers from biohazards is not just a moral obligation, it is also a legal requirement. Many countries have specific regulations and standards in place to address workplace biohazards. For example, the Occupational Safety and Health Administration, or OSHA in the United States, sets standards for handling blood-borne pathogens and other biological hazards. These regulations mandate employers to provide a safe and healthy work environment for their employees. Beyond legal compliance, ethical considerations are paramount. Employers have a moral duty to ensure the well-being of their workforce. This includes taking all necessary measures to prevent biohazard exposure, providing appropriate training, and fostering a culture of safety in the workplace. Section 8. Global perspective biohazard control across borders. Biohazard control is not limited by geographical boundaries. The increasing interconnectedness of the world means that infectious diseases can spread rapidly across borders. International collaboration is crucial for effective biohazard management. The World Health Organization, or WHO, plays a vital role in setting global standards for biohazard control, providing guidance on outbreak preparedness and response, and facilitating information sharing between countries. International cooperation is essential for addressing emerging biohazards, sharing best practices, and supporting countries with limited resources to strengthen their biohazard control measures. Section 9. Future challenges, emerging biohazards and workplace safety. As we move forward, new challenges will continue to emerge in the field of biohazard control. The emergence of novel infectious diseases, the increasing resistance of pathogens to antibiotics, and the potential for bioterrorism all pose significant threats. Climate change is also likely to influence the spread of infectious diseases, potentially exposing workers to new biohazards. Addressing these challenges requires ongoing research, innovation in protective technologies, and adaptive strategies to anticipate and mitigate future risks. Investing in research and development of new vaccines, diagnostic tools, and treatment options is crucial. Equally important is strengthening global surveillance systems to detect and respond to outbreaks swiftly and effectively. Section 10. A safe and healthy future. Prioritizing biohazard control in every workplace. Creating a safe and healthy future for all workers demands a proactive and comprehensive approach to biohazard control. This requires a shared responsibility among governments, employers, and employees. Governments must enact and enforce strong regulations, provide adequate resources for research and public health infrastructure, and ensure access to affordable health care for all. Employers must prioritize worker safety by implementing robust biohazard control programs, providing regular training, and fostering a culture of safety. Employees must actively participate in safety programs, report any concerns, and adhere to safety protocols diligently. By working together, we can create a future where every workplace is a safe and healthy environment for all. Let us strive to make this vision a reality.